Standard precautions are designed to reduce the risk of transmission of unrecognized sources of bloodborne and other pathogens in healthcare institutions. So let's spend some time talking about them. This overview follows pretty closely to the ARRT outline. Standard precautions are meant to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized sources. They're the basic level of infection control precautions that are to be used as a minimum in the care of all patients. This quote comes from the World Health Organization. They have a pamphlet called Standard Precautions in Healthcare. You can find it pretty easily on Google. So standard precautions apply to blood, all body fluids, secretions and excretions except sweat, non-intact skin, and mucous membranes. Standard precautions also reduce the risk of transmission from recognized sources of infection by including precautions for 3 modes of transmission, namely airborne, droplet, and contact transmission. So we need to be careful anytime we're going around the patient's nose, mouth, eyes, rectum, genitals. For obvious reasons, they are mucous membranes. But also being careful about cuts, abrasions on the skin. Older patients can have, their skin is very delicate, so be careful in making patient transfers. Who's at risk? We're doing this for ourselves as well as our patients. We're trying not to transmit things from ourselves to other patients. So anyone whose resistance to disease is decreased in that, so that would be pretty much anyone in the hospital. This can include lowered resistance caused by age, existing illness, fatigue, and stress. Elderly patients sometimes have a weaker immune system. Elderly patients are also hospitalized more, so the risk for hospital-acquired infections is increased. And also infants. Good hand washing is the most effective method to prevent the spread of infection, period. You can also use alcohol-based hand cleaner in the place of washing hands and soap, so we'll talk about that in just a sec. Avoid at any time touching your own eyes, nose, or mouth. I've come up with this mnemonic to help us remember hand washing, the order. On the wet soap, lather and rinse the towel off. Kind of nonsense, but basically you need to use a towel to turn on the water faucet if there's not foot or knee levers. Wet your hands thoroughly, then soap up with an ample amount of antimicrobial soap. Then lather for 20 seconds. I sing happy birthday to myself. And an order to go in is like the palms, back of the hands, fingertips, and the areas between the fingers. Rinse your hands off, towel off, and then turn the water off with the paper towel. When we're using the waterless hand sanitizer, make sure that all visible dirt is removed from your hands. You'll want to apply about a dime-sized amount of the sanitizer to the palm of one hand, and then rub your hands together until the sanitizer is completely absorbed. So we talked a little bit in another presentation about tuberculosis, and students are not permitted to enter an isolation room with a positive tuberculosis patient because we will not be fitted for N95 masks. Nevertheless, students are able to go inside of isolation rooms with patients as long as they're using personal protective equipment. The main form of personal protective equipment that students should be familiar with is our gloves. So anytime that we come into contact with secretions or excretions, and this is the fun stuff, sputum, urine, feces, wound drainage, we need to be wearing disposable gloves. These gloves should be removed before leaving the patient's room, and the hands should be thoroughly washed. I'm reading directly out of the Medical Radiography Clinical Handbook right now. Gloves should be worn when handling blood or blood-contaminated equipment. Hands should be thoroughly washed afterwards. All drainage wounds should be treated as potentially infectious, and students should wash hands and change gloves after performing one procedure prior to performing any other procedures. Gowns, masks, and eye protection would be institution dependent. So I'll leave that up to the clinical preceptors to train you on the correct usage of those things should the eventuality arise. Basically, medical asepsis is fairly common sense. Medical asepsis deals with reducing the probability of infectious organisms being transmitted to a susceptible individual. So stay at home when you're sick. Use a tissue to cover your mouth when you sneeze or cough, and ask patients who are coughing or sneezing to cover their mouth and noses with a tissue, or do the vampire cough if need be. Wear a clean uniform daily and remove it immediately upon going home. Don't be the person who's out shopping at the grocery store wearing their scrubs. That is gross. Shun that person. Perform hand hygiene frequently. Follow established precautions when handling patients' linens or items that could be contaminated. Practice good housekeeping techniques in your work area. As students, this is kind of one of the #1 things that you can do to get ahead, is to clean up the room frequently, and to do it in the way that that institution prefers you to do it. When in doubt about something, don't use it. And immediately dispose of linens, instruments, or any item that touches the floor. The floor is always considered contaminated. You want to bag all disposable contaminated supplies and then clean the surfaces with appropriate cleaning supplies. Each clinical institution will have slightly different cleaning supplies, so refer to them for that. Whenever you're cleaning something, use your gloves, wipe up immediately, and then dispose of the gloves and the cleaning materials appropriately. These are some of the references that I used, and thank you so much.